First is a lot of pain. So in the presence of pain, the proprioception is disturbed because of the alteration in reflex activity and the increased sensitivity of the muscle spindles. Next is joint effusion. So joint effusion refers to the swelling within the joint capsule, which is common after ACL or PCL injury in the knee joint. Joint effusion will cause inhibition of the skeletal muscle, mainly quadriceps, and therefore impair proprioception. Then fatigue, it causes altered muscle activation and muscle spindle discharge, and therefore increased sense of effort. Common example is after performing hard physical exercises, we experience clumsiness. Like after performing around 50 squats on the first day, we may not feel our legs, and therefore we may feel clumsy. Next is trauma, which causes disruption of the musculoskeletal tissues directly, and therefore damage to the mechanoreceptors, which are innervating those tissues, and therefore impaired proprioception. Assessment of proprioception can be done by two types of tests, which are specific tests and non-specific tests. Specific tests will involve joint position sense, which we test by lightly holding the great toe in lower extremity and the thumb in the upper extremity. And we demonstrate the patient various movements, which may be dorsiflexion, neutral, and plantar flexion, and then ask the patient to close the eyes and identify which is the movement. Specifically in ACL injury, we can ask patient to stand facing against a wall, and the therapist performs a passive movement of knee flexion very slowly, and we can ask patient if he could feel that the movement started or not. Then kinesthesia can be tested by asking the patient to align the affected limb with that of the contralateral limb. Then force sense, which can be measured with pressure biofeedback device, which we will be seeing in the